Hello, thank you for having me. I'm delighted to be here. What a beautiful day it is, and I'm so happy to be sharing it with all of you. My name is Nurul Darmawulan. I'm a fourth-year bachelor nursing student at Universitas Padjadjaran, Indonesia. The author of this paper is me, Ms. Maria Komaria, PhD, and Mr. Hidayati Arifin, SCOP Nurse MCOP. And this paper title is Effectiveness of E-Module for Increasing Knowledge and Learning Motivation on Dengue Hemorrhagic Fever among Nursing Students. Dengue fever, DHF, is an infection caused by dengue virus transmitted through female mosquito of Aedes aegypti and Aedes albopictus. Ministry of Health 2016 report that the prevalence of DHF in Indonesia has always been a public health issue. Lack of knowledge and about vector prevention is one of the factors that cause the prevalence of DHF. Based on Tacriadi et al. 2015, insufficient knowledge is a higher risk. Other studies by Sukayoni et al. 2021 state that knowledge is significantly related to attitudes and behavior in eradicating mosquito nets. Students as agents of change have an essential role in people's life which can apply in health education to prevent DHFs. So students need sufficient knowledge in distributing this information to the public. Gain et al. 2014 report that DHF's knowledge among nursing students was relatively low. In addition, according to Chetin Dinar 2016, the increase in knowledge is influenced by learning motivation. For these reasons, increasing students' knowledge need to improve with more exciting and applicable learning methods. So this research develops learning media with e-modules. The availability of learning media that follow technological development can increase learning motivations. According to Mole 2011, state that the learning process in nursing should use the most efficient learning methods to become professionals and maximize their learning. So what about the objective of the study? This study aimed to evaluate the effectiveness of using DHFE module in increasing nursing students' knowledge and learning motivation. And the methods, this study was conducted with a pre-experimental design with one pre and post-test group. This design allows respondents to be tested before and after treatment, and to show the dependent variables effects better. This research was undertaken from September to October 2021. And the population in the study were third-year nursing students at Universitas Padjadjaran, Indonesia. And we use process sampling to require respondent. And the minimum sample in this study was calculated by G-power. And the result is 44 respondent was required. So this and then this study was ethical approval from the ethics committees of the Health Commission of Universitas Padjadjaran, Indonesia. Instrument we use is DHFE module that contains the definition, epidemiology, etiology, signs and symptoms, complications, diagnosis, examination, and nursing care for DHF. An instrument for collecting data, we use knowledge questionnaire that was developed by the researcher. And this questionnaire already has been tested for validity and reliability on 30 trial respondents. The validity test result with person product moment obtained 14 valid items, and the reliability test with crunch band alpha got 0.652 on 14 items. And also the last questionnaire is student motivation towards science learning by Tuan et al. 2005. It contains 35 questions using a Likert scale. Data collection procedure. Data collection procedure is step by step. Step 1, the researcher inform consent to for the respondents listen on the first day. After agreeing, they need to do pretest. Then respondents were given a module access link where respondents could study the contents of the module for 3 days in the range of periods. Respondents were asked to fill out a logbook daily during research procedure. In the end, respondents need to fill out post-test. So what about the data analysis? The data analysis we use is univariate and bivariate. Univariate analysis was used in the form of preferences and percentage distribution to describe the characteristics of the sample. In the contrast, bivariate analysis with different tests was used to determine difference in each pretest and post-test score. So the normality test we carried out was carried out for the prerequisite test to choose the data distribution using the Kolmogorov-Smirnov. And after this, we found that knowledge variable were not normally distributed, so we use Wilcoxon-Stegner rank. And then learning motivation, this was normally distributed, so we use dependent parity tests. Oh, data analysis was performed using the SPS as version 25 application for Windows with significance of p less than 0.05. So the result of our findings showed that a total of 45 students participate in the study, and in table 1 we can see that the majority of respondents are female and 20 years old. Most were from Jatinangor campus, and more than half live in urban area. And based on experience related to DHF, it can be seen that family history have no history of DHF and have no record of DHF. So based on this, on table 2, we know, this table 2 was showed that different test results. So based on this table, it can be seen that there is an increase in the mean pre-test and post-test score in both variables. And also this p-value is significant difference in both variable with knowledge was 0.02, learning motivation was 0.002. So the finding indicates an increasing post-test and significant difference between pre-test and post-test on knowledge and learning motivation. In knowledge, our finding was in line with quasi-experimental study by Sitors et al. 2019, which show a significant difference in knowledge after a module administration, and the review by Shah and Stefaniak 2018 that was report an increase in post-test score for students who use e-module in different health disciplines. And why e-module can increase knowledge? It was because the independent learning process with the help of e-modules is systemic and explicit, so that undergraduate research students can quickly learn the content of material, repeat their learning, and make study time effective as desired. So this statement was supported by related research by Logan et al. 2021 and Subiani et al. 2019. And meanwhile, in learning motivation, the finding in line with quasi-experimental study by Asriel et al. 2019 show that rise in post-test score after using e-modules, and previous research by Putri et al. 2020 has also stated that e-module effectively increase learning motivation and improve learning outcomes. And why it happens? It's because the use of e-module with high quality graphic resolutions and electronic media can trigger an increased learning motivation during the learning process. The use of electronic media makes the learning experience fun and not monotonous, then improve students' skill in using technology to become an additional advantage. So previous research state that student was enthusiastic and actively involved during the learning process with e-module. And e-module provide an experience of learning activities to reflect and apply the learning contents. So the increased learning motivation can make student interest in the content of the e-module material so that student will learn the materials. Strength and limitation of the study. The study has advantage, namely the appropriate research design question to focus on measuring the effect of the dependent variable, attractive and interactive e-module, and advanced e-module designs. And the limitation, namely the research sample is still limited and the sample selection is not randomly random. The conclusion. Based on our finding, we conclude that e-module as learning media is a promising intervention to improve nursing students' knowledge and learning motivation. This study recommends considering e-module to support the learning process by the educator of the university. Thank you so much for being so attentive. I apologize if there are many shortcomings for me. Goodbye and have a nice day. Thank you.